Hello, I'm Stephen McCulley. I'm a consultant reconstructive and aesthetic surgeon, and I'd like to talk to you about wrinkle treatments. It's important you understand how wrinkles occur. Now, in our face we have muscles around our eyes, in our frown area, in our forehead, around our mouth, and as these move they cause the skin to crease up, a little bit like an accordion causes the centre of the accordion to crease up. Now, also as we get older, the more that the skin keeps on being subjected to the movement, we develop permanent creases. So children have movement wrinkles to begin with, but they don't have permanent wrinkles because the skin hasn't got that permanent crease within it. Other changes that occur is that we develop some indentation from loss of fat or change in the fat around the corner of our mouth or from the indentations around the frown areas. So our treatment strategies are really either to stop the muscle movement, and that is with Botox treatments, where we with very fine needles inject into these areas to stop the muscle from moving, and that will last from 3 to 6 months. By contrast, when you have an actual indentation, we can use filler treatments, which are essentially a type of very sticky natural jelly which we can put underneath the skin to help physically plump it up. Now, these will last between 6 and 12 months, and often the use of fillers and the Botox or anti-wrinkle injections will be used in combination depending on what your requirements are. The last thing that we can do is resurfacing. That's for very fine wrinkles on the skin, and that can be done either with a laser, with a little chemical or acid peel, or occasionally with dermabrasion, which is like a sort of medical type sandpapering, but that usually requires a proper operation. The most common in terms of outpatient treatments are the anti-wrinkle injections and the filler treatments. You may get a little bit of bruising, so be aware of that. There's also a small chance of the filler producing a little bit of lumpiness under the skin, or a slight change in your brow or even eyelid position if the Botox gets into the wrong place or too much has been put in. And it is for that reason it's very important that you make sure you have an expert doing it. So whether you're going to come to see myself or an expert near you, I wish you all the best with your wrinkle treatments.